This product is a combination of vitamins and minerals that are essential for the body. It is used to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins are important for the body and help to maintain good health. The daily gummies provide various benefits such as supporting overall health, boosting the immune system, and promoting healthy growth and development. The recommended daily dosage is typically 1 gummy per day, and it is best to take it with a meal to enhance absorption. Taking the gummies in the morning with breakfast is an optimal time as it helps to kick-start the day with essential nutrients. Make sure to thoroughly chew and swallow the daily gummies, usually once a day or as directed by your doctor. It's important to follow all the directions on the product package and not to take more than the recommended dosage. If you have any questions, be sure to ask your doctor or pharmacist. Taking the daily gummies regularly will help you get the most benefit from them. Try to take them at the same time each day to help you remember. When taking daily gummies, you may experience temporary side effects like constipation, diarrhea, or an upset stomach. These effects usually go away as your body gets used to the medication. If they persist or worsen, be sure to inform your doctor or pharmacist. If your doctor has prescribed daily gummies, they have determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. Although rare, a severe allergic reaction to daily gummies can occur. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. Remember, this is not a complete list of potential side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. In Canada, report any side effects to Health Canada at 1-866-234-2345. It's important to keep multivitamins containing iron out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it's important to seek medical help right away or call a poison control center. Before starting to take these daily gummies, make sure to inform your doctor or pharmacist if you are allergic to any of the ingredients or if you have any other allergies. These gummies may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist for more details. Also, be sure to let your doctor or pharmacist know about your medical history, especially if you have a history of alcohol use/abuse, liver problems, or stomach/intestinal problems such as ulcers or colitis. If your brand of multivitamin also contains folic acid, be sure to inform your doctor or pharmacist if you have a vitamin B12 deficiency, pernicious anemia, before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating this anemia, which could lead to serious nerve problems. It's important to consult your doctor or pharmacist for more details. It's also important to note that these daily gummies may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, or phenylalanine, it's crucial to consult your doctor or pharmacist before using this drug safely. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, be sure to consult your doctor before using this medication. When taking daily gummies, it's important to be aware of potential interactions with other medications. Discuss all the products you use, including prescription and non-prescription drugs, herbal products, and supplements, with your doctor and pharmacist. If your multivitamin contains iron, be cautious about taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Ask your healthcare provider about the best timing for your doses to avoid any potential interactions. Additionally, if your multivitamin contains folic acid, inform your doctor or pharmacist if you are taking anti-seizure drugs. It's also important to note that daily gummies may interfere with certain lab tests, potentially leading to false results. It's crucial for lab personnel and all your healthcare providers to be aware that you are taking this medication. If you suspect an overdose and the person is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Signs of overdose may include stomach pain, nausea, vomiting, and diarrhea. Make sure to attend all your medical appointments and lab appointments. It's important to note that these daily gummies are not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. So, try to maintain a well-balanced diet and follow any dietary guidelines provided by your doctor. If you are taking daily gummies on a prescribed schedule and happen to miss a dose, simply take it as soon as you remember. If it's almost time for your next dose, it's okay to skip the missed one. Just continue with your regular dosing schedule. And remember, it's important not to take a double dose to make up for the missed one. As for the optimal timing, it's best to take daily gummies at the same time each day to help maintain a consistent level in your body. It's important to store daily gummies at room temperature, away from light and moisture, but not in the bathroom. Make sure to keep them out of reach of children and pets. When it comes to disposing of daily gummies, do not flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.